So one of the things that Dr. Park and I have been seeing a lot of lately are patients who are interested in body contouring procedures, and a lot of people don't know what that entails. We're getting some common questions, and I thought that I'd take a minute to answer some of those things that are commonly asked us when people come in. So first of all, what do we really mean by body contouring? Well, body contouring is just a general term for any technique that is meant to shape a part of any part of the body after massive weight loss surgery. And so what kind of surgeries are we talking about? We're talking about things like Roux-en-Y, gastric bypass, a gastric sleeve, things of that nature, any type of restrictive or malabsorptive surgery that can help you lose a significant amount of weight. And being a part of these patients' journey is hugely fulfilling for both Dr. Park and myself. It's really awesome to have people who have committed to changing their lifestyle and being very healthy. So one of the things that Dr. Park and I have been seeing a lot of lately is patients who are presenting to us for body contouring procedures. And so I thought I would take a minute to answer some of the more common questions that we get whenever people come in and talk about these procedures. So first of all, what do we mean by body contouring? Well, body contouring is just a general term for any type of either liposuction or excisional techniques that we use to shape different parts of the body after massive weight loss surgery. And this can be a restrictive surgery like a gastric sleeve procedure, or it can be a malabsorptive procedure like a Roux-en-Y gastric bypass. Either patient and either type of procedure, it can be used prior to any type of body contouring procedure, okay? And so you are a candidate even if you've had a malabsorptive procedure, but you do need to have certain labs before you undergo any type of body contouring procedure. And usually we'll get things like blood counts, check your nutrition labs, make sure that you're followed regularly by a nutritionist or your general surgeon, and we'll check all the things that we need to prior to undergoing any type of body contouring procedure. Now, the more common things that we hear about in terms of body contouring are, of course, the abdomen, right? Everybody's looking for a tummy tuck and trying to get that overhanging skin taken care of. But some of the things that you might not think of when you think body contouring that are more common that people ask for are things like chest contouring in men that have lost a lot of weight, or also breast contouring in women that have lost a lot of weight. We do a lot of either procedure, and there are different techniques we use for men and women to give you either a more masculine or feminine shape to the chest. Women who have lost a lot of weight are often candidates for a augmentation mastopexy procedure, where we'll not only do a breast lift, but also add an implant to that to give you a little bit more what we call upper pole fullness. Another thing that is very commonly asked about is contouring of arms. And I think arms are a little bit deceiving, because while many people think that they can be treated with liposuction alone, most people who have had massive weight loss surgery will need some sort of excisional technique in the arms to really take off that excess skin and give you the contour that you're looking for. Arms are often combined with chest or breast contouring because the scars can be very favorable and really gives you a very nice result in that area. We do get a lot of questions about thighs, and I will tell you that thigh contouring can be a very difficult thing to combine with other procedures because of the limited mobility following thigh contouring. With all of our body contouring procedures, we want you to be up and moving around right after surgery. And it's very difficult to do that with thigh contouring in general, but it's especially difficult when you combine thigh contouring with any other type of body contouring procedure. So we usually do thigh contouring as a separate procedure here at the Park Clinic, but it is often, again, a very good procedure that can give very great results and really help you complete that weight loss journey and feel more on the outside like the person you are on the inside. People often ask us, well, what is my goal weight? What weight do I need to get down to prior to undergoing a body contouring procedure? And what I'll tell you is that you really need to be at a happy, stable weight for about 3 to 6 months before we'll undergo any type of body contouring procedure. And what I mean by that is that I know that we all have very large weight loss goals for ourselves whenever we start this journey, but we're not always able to exactly get there. And a lot of times, getting off that little bit of extra skin, whether it's on your arms, chest, or abdomen, or thighs, can really help you complete that final part of your weight loss journey. And so I wouldn't necessarily focus on an exact number. I would get yourself to a happy, stable weight for at least 3 to 6 months, and then we can undergo the body contouring procedure to help you out with that excess skin. So if you're interested in any of those things, just give us a call. We'd be happy to talk to you about them.